So we have a comprehensive ophthalmology practice. We have a lot of glaucoma patients here as well. And so with this Duet laser, we do approximately on a per month basis about 50 SLTs a month and approximately 40 to 50 YAG laser capsulotomies and maybe 5 to 10 YAG laser peripheral iridotomies. Well, the Duet SLT has really made this a treatment of glaucoma patients and patients with posterior capsulotomies more effectively. We're able to more effectively treat them. With the selective laser trabeculoplasty, I think that we've just really been able to simplify the management of glaucoma. And I know a lot of physicians feel that way. With the cost effectiveness and the low side effect profile and the patient, issues of patient compliance, it just really made the management of glaucoma much more efficient. Well, initially, I would say that we did not use this laser as a primary therapy. We used it more as a secondary therapy. But over the past couple of years, and with the increasing research showing that primary therapy with SLT is even more effective than maybe as an adjunctive therapy, we have pushed more towards that direction. In general, I would say maybe about 40% of patients, 40 to 50% of patients get the SLT laser as a primary treatment, and maybe about 30 to 40% adjunctive, 20% as a replacement, and maybe 10% as repeat. And now that we've had the laser for about 6 years, as we know, some of the effectiveness from the patients initially treated may be wearing off. So I think we'll be doing maybe more repeat lasers here over the next several years. I usually present it to patients as an option. I tell people that there are basically two ways to start the treatment of glaucoma, and it's drops or laser. And when I explain to patients the laser and the drops and what the side effects can be, almost everyone now says they would like to have the laser first. And I think maybe a few years ago it wasn't quite the same, but I also think that people know other people having treatments with laser. And they also understand that we're telling them, we're being honest with them, we're telling them how we would want to be treated. I always tell patients, if I had this problem, this is something I'd consider first. And I think that helps. I think people understand that. They respect that. The Lumenis SLT has really changed the management of glaucoma for us over the years, in that we are feeling more comfortable about treating patients with SLT as a primary therapy. It's just the side effect profile is wonderful, and patients just really do well and respond well to the treatment. And it's just made the issue of non-compliance with patients, it's helped that problem, because as we know, a lot of patients who are on drops for glaucoma don't follow the regimen as they should, and so it's certainly helped glaucoma from that standpoint. And it's so cost efficient. I mean, this is it's been shown that over the years that you may need drops. If laser has been able to effectively control the glaucoma, that it's much more cost efficient. So for both the patient and for the insurance carriers. Repeatability of the laser was definitely a factor. We feel more comfortable. And some people felt that maybe you could repeat the argon laser trabeculoplasty, but I think most people did not feel comfortable doing that. And with SLT, we've been able to repeat over top of ALT, which is huge because a lot of patients did have that laser in the past. And the success rate with the repeatability has been excellent, so that definitely impacted our decision. I was fortunate to train at the University of Pittsburgh, where they introduced us to the SLT when I was a resident, and so I got to use it, and I was comfortable with it, and I think that had something to do with why we brought it into our practice so early. But the repeatability was a big factor. Over the years, we've had very, very few problems with this laser. And you look at the drops used for glaucoma and the side effects of these medications, not only systemic but the ocular side effects, which really seem to affect patients, just their quality of life. So using this laser just seems to make a lot of sense, and it helps patients. This treatment just helps patients with cost saving and also compliance. Well, I think besides the fact that this is an excellent product, you know, the magnification, the optics, everything is very good with the laser, and it works well. It's a cost-saving device, space-saving. You know, we only need one unit instead of two. It eases the patient flow. You know, we can sit at the machine, and often if I do, you know, 15 lasers or 20 lasers at a time, each patient, it doesn't matter if they're SLTs or YAG capsulotomies, they can come in whatever order, and nobody has to change or move. Our nurses are all in the same place. You know, it makes sense for various reasons. We've had an excellent experience with Lumenis. From the very beginning, our sales representative has always been very helpful, and anytime we need anything from a service standpoint, Lumenis has been very accessible and available in a timely fashion. Working with Lumenis has been an excellent experience. I really don't have anything negative to say because they've always been there for us and done everything we've needed, and actually have been proactive, and before we've even asked for anything, they've been able to provide. So it's been wonderful. We use the brochures. I give everybody a brochure because I really feel that, you know, I can explain to the patient what their disease is and what this treatment is, but sometimes patients don't listen to everything or can't, you know, once they hear maybe they have glaucoma, they can't really hear beyond that when they're in the room, and then after they leave, they start thinking, you know, what did she just describe to me? I don't understand what's going on, and then they have something to refer to. And I always tell patients, you know, the pictures help, and, you know, it makes sense to have a reference. And most people do read the brochure, and I just let them read that at home. I give it to them at the end of the office visit and just say, if you have any questions, to call us. And nobody really calls us after that, you know, because I explain it well in the beginning, but I think the brochure really helps, you know, patients have a reference. We know that our population is getting older. We know that glaucoma treatment, there will be more patients to treat, and so this is becoming a more important, you know, modality. So hopefully people will really become aware of this over time. Almost everybody tells me that the laser is not what they expected. So even though I tell patients, you know, it's just like sitting up and having an exam in the slit lamp, and it's really just that machine attached to a laser, and they're wide awake and they won't feel anything. And it was very few people will feel a little twinge, but nothing significant. I tell them that, and they still, after the laser, say, you know, you can tell people get very anxious, and that's pretty normal, but almost everybody tells me that the experience was not what they expected, and it was, you know, much better. So, and I think, as I said before, I think that as people have their friends and neighbors have treatments with laser, and that's happening, we see that all the time, that people will become more comfortable with the treatment. Well, I think initially when you look at the cost, that's always the first obstacle, and that's really the main obstacle for this laser or any other laser. But when we analyzed the cost-benefit ratio and looked at, you know, how many lasers would maybe we be performing, and you know, and looking at that, we quickly decided that this laser would probably pay for itself pretty quickly, and it did. It really did. With our practice, we have a lot of patients. We do see a lot of glaucoma patients, and so that helps. But I think even if we did half or a quarter of the volume, this laser would still pay for itself in a relatively, you know, quick amount of time. Right. I've actually had friends of mine come to me and ask me about the laser, co-resident of mine actually, who is a cornea surgeon, and in his practice they have a glaucoma specialist who doesn't currently do the laser, and he was asking because he felt that it should be done, and I believe he is going to purchase the laser based on what I told him, because I just explained that it's something that you don't really have to think long and hard about. It just makes a lot of sense. It's great for the patients, it's great for us.